So I'm from West Columbia. My family actually has pretty deep roots in the West Columbia area. And so grew up just down the street from Lexington Hospital, so I have a long history with the hospital itself. I've actually done 2 prior jobs before. I was a volunteer one summer in the mailroom, and that was great at that age, just to be in the hospital and working. Then later I came back after college to work in the emergency department. I was an ED tech there, and at the time that was just a wonderful experience for myself to get more direct patient interaction, wanting to get into medical school. I did my undergraduate at Furman University, and then after spending 4 years there, I wanted to move back to Columbia, so I did both graduate and medical degrees at the University of South Carolina. During my time in medical school, I really knew that I wanted to go into cardiology. And so in order to do that, and knowing that I wanted to come back to Columbia after training, I knew that I needed to go to an academic institution and get good training so that I could come back. And so I decided to go to Wake Forest for all of my training in internal medicine, cardiology, and interventional cardiology. They have a great reputation in cardiology, and so I was fortunate enough to come out at a time to where new techniques and things that we are doing now at Lexington, I was able to learn as a trainee, as a fellow. So radial access, TAVR, MitraClip, ECOS, all those things that we are doing now at Lexington, I was fortunate enough to be able to learn right when they were coming out at Wake Forest. I spent 8 years in Winston-Salem. It was a wonderful time, but at the end of the day, my wife and I knew that we wanted to come back home. My folks are still here, my family's here, my wife's family is here. We have 3 kids that were all born in Winston-Salem. We wanted to come back and be with family, and so this was the obvious choice to come back and be at Lexington.